It's interesting that you mentioned wanting to share this message. There's not many other topics of discussion that I find that people learn about, apply in their own life, and they get so excited about it that all they can think about doing is finding a platform, like starting a podcast, doing a YouTube channel, starting some kind of social media to try to get the message out because it's so critical and so important in their own lives that the only thing they want to do is share it.
Yeah, and it's as anybody said, well, you want to tell everybody because it works so great, and nobody wants to listen to you. So everybody tells the same story, and well, what I see when I'm in my office, I usually, as I said, I'm a periodontist, so I do a lot of surgeries, and for the healing process, you need a lot of collagen to heal perfectly, and then when you think about it, how collagen works in your body and how it's produced or destroyed and then you see all these pathways which were good or bad, and then you find out, well, it's got all these connections together, and that's why the reason why you have so many people with the same situations, although they're totally different, but then you find out that 20% of some people, of a group of some people, actually have the same problems. Then you go try to dig deeper, and then you find out, well, that works really well, and to understand why they have these problems but still they won't listen to you. So to get this message out by you going online was probably one way to get myself to try to educate at least some people because I usually or I do for about 20 years now. I train periodontists to become better, to do this kind of surgery stuff. And I've got a group of teachers who teach other clients how to do these surgery things. And everybody is talking about how you do the surgery, how you do these kind of surgical procedures, how you cut, how you suture, and all that. But what I asked when we met last year, because we only meet once a year, I asked, is there anybody knowledgeable about why we have some problems with some patients? Because when you see the statistics about in Europe, it's about 75% of all people in Europe are metabolically ill. In the US, I think it's like 90%.
Yeah.
So basically, even if we do normal things like extracting a tooth, not even weird stuff, we're working on sick people. And what kind of problems do we get with these sick people when we do normal surgery or normal stuff? Even if you cut your fingers and they get problems or the wound doesn't heal as it should be. And if you think about it and you try to understand all the biochemistry behind that, it's far more interesting to find out how this healing works than after 30 years of doing all these procedures. It's not really, well, it is interesting for me because that's why I love to do it, but actually, it's now after 30 years doing the same thing over and over again. Um, it's not that interesting for me anymore to do all this stuff because it's not getting boring, but you get used to do it, and so it's no different for me to do one implant or 10 implants or do one small surgery or one big surgery, or it's not the point. But when you talk to colleagues who teach all the same things, they do not know anything about this situation that 75% of Europeans are metabolically ill. And we have to solve these problems, especially in vulnerable groups. And we come to this probably later, which I think are vulnerable. Um, but it's really funny because there's only one oral maxillofacial surgeon in this group who said, yeah, I thought about that too, and I think we can do it with like vitamin C infusions and all that. And yeah, exactly. Mm-mm. It's not the way because the body produces glutathione, which is a far better antioxidant, and it's that got no other problems like high doses of vitamin C. And if you understand how vitamin C is works in the body and high doses, what they can actually do, it's not the best way. But everybody here, especially here in Germany, I know I don't only know that here for Germany, but there are more and more people who think that a biologic approach to dentistry is taken out root canal treated teeth or taken out titanium implants. And I say, okay, you take out a tooth which is not perfectly, but it works. Do you think you can heal him when he's got diabetes and blood pressure medication and all that stuff? So, in my opinion, you have to change this problem first. Then you can decide whether it's necessary to take out special teeth and do other kind of procedures. But as a dentist and focused on dentistry, it's like an the eye doctor. Sorry. uh, they only think about their profession. And it's not a thing if you've got only a small practice or you're the professor of a large university clinic. You only think about your business and not about the whole body or the whole problems that they have. And as I said just today to a patient, doctors are not trained to desubscribe medications. They only put one medication on another and another and another.